Specialized practice consulting, and we help doctors add and grow high value cash services in their practice, like spinal decompression, peripheral neuropathy, and chronic knee pain. And today I want to talk about the 4 keys to how to find the right spinal decompression table for you and your practice. Now, before we dive into that, if this is something that you're thinking of adding to your practice, a high value cash service like decompression, neuropathy, or knee pain, do yourself a favor. Go check out the masterclass that I've created for you. It's at drvinceleone.com. I'm going to go through the 4 keys to how to add a high value cash service to your practice predictably and profitably. Okay, so go check that out at drvinceleone.com. So let's go ahead and dive into today's topic is how to buy a decompression table that's right for you. And I'm going to go through 4 key aspects that that you can use when looking at tables. And so we're going to talk about 5 different tables: the Accuspina, the DRX 9000, the DOC, the Hill DT, and the KDT. Okay, so and the 4 key aspects we're going to go through: price point, efficacy, support for the doctor from the company, and the footprint of the table itself. So let's go talk about price point, because this is most doctors, that's the first thing, right? How much is it going to cost me? So let's go from lowest to highest, right? So lowest is going to be KDT at about 11,000, and these are all new. And of course, you can get used ones, but I typically don't recommend getting used. You just never know what's going to go wrong with them. There's no support, blah, blah, blah. So new, we got KDT at 11,000. Then we have the DOC at about 16,000. We have the Hill DT at 30. Then we have the DRX 9000 at around 40-ish, right? Depends if you do just the lumbar or if you do lumbar and cervical. It's a little bit more. And then finally, the Accuspina at 60, roughly. Now, the DRX that may be a little changed a little bit because those are not new anymore, right? So Salim over at Excite Medical in Florida, he buys the tables, he refurbishes them, and then he sells them. So they have, they've all been upgraded and all that type of stuff, but they're just not brand new. But they're still going to be about that 40 grand. So that's price point. So you just got to figure out, and of course they all have financing and all that type of stuff. So you don't have to write a check for 40 grand or 11 or whatever. But price point, you got to figure out, well, what is going to make most sense for you? And do you need the big fancy one, or do you need, or is the one that fits your office and all? Anyways, one thing I'll say on that though, don't expect like the table to sell itself. Like if you go with the big fancy one of the, Accuspine and the DRX 9000, those are the big fancy ones, right? So they look super impressive. Like I'll give them that for sure. I mean, we had 4 of the DRX 9000. So yeah, they do look impressive, but don't expect patients to just write a check because the table looks fancy. That won't happen. Okay, it comes down to rapport with the patient and the doctor, and ultimately the patient's trust in you that you can help them. That's really what it comes down to, whether they're going to invest in their health by writing a check. So that's price point. Number 2, efficacy. Now, what I've found is, because I have clients that have all these tables, and they all like them. They all get great results. That's why I hear, by and large, they all say, "Oh, I get great results." The only table, and it's not in this list, is where doctors are not sure if they're really getting the results, is that the Back on Track, right, from ErgoFlex. Now, my understanding, and if anyone from ErgoFlex is listening and this is wrong, please reach out to me and I'll correct it. My understanding is that is not true decompression from the Back on Track. Now, by the way, the Knee on Track I really like for our chronic knee pain protocols. But my understanding is the Back on Track is not true decompression, and so I wouldn't recommend it. But by and large, all the other tables, it's true decompression. It's going to pull and release multiple times over the course of the care or over the course of the treatment time frame, 20 minutes, 14 minutes, 25 minutes, whatever the number is. And what that does, right, is that pull and release, that creates the negative pressure in the middle of the disc, which allows it to absorb water, right, and to hydrate the disc, right? The disc is 86% water. And when it's injured, it's somewhere less than that. We need to get water back in the disc. That is the the gist of spinal decompression. That's why it's so effective. Um, but so that's efficacy. So I think that, from that perspective, I think you can feel pretty confident that really whatever table that you buy, it's going to do the job, right? As long as it's true decompression, and these tables are. So that's number two, efficacy. Number three is support. Now,
Angie's List is now Angie, and it's easier than ever to get your projects done right. Inside,
I've now, and again, cross sell. I've heard good support on the DRX 9000. Slim is very responsive, but it's just kind of, it's from my understanding, it's just kind of one guy and one repair guy, right? So who knows? That may be a little bit of a challenge. But I also think of support in terms of clinical, right? And hands down, the winner on this is KDT. They have multiple seminars per year for basic and advanced doctors, right? So that they can get you trained up on how to use the machine and what the different protocols are and all that type of stuff. Of course, I help doctors with protocols too, but just using the machine, right, and being technically proficient at it, they do a very good job. They're the only one of all those companies that actually have seminars on a regular basis. And by the way, I know Jeff Misko, the owner. He comes from a chiropractic family. His dad famously told him, "Hey, this industry does not need another chiropractor. What it does need is a honest, manufacturer company." And manufacturing companies are very good at sales, not so great at follow-up. So KDT wins that one hands down. So that's support. Finally, we have the footprint. How big is the table? And is it going to fit in your clinic? So most doctors don't have a 10,000 square foot clinic and they can just stack tables, left, one side or the other. Usually they're in like 1,000 or 1,500 square feet, maybe 2,500 square feet. So you have to really keep this in mind, because AccuSpina and DRX 9000, it's going to take up a lot of space. I mean, you're either you need a big open adjusting area and you're going to put it in a corner, or you're going to need a dedicated room. And by the way, that doorway better be pretty big to get everything in there. So whereas the footprints of the KDT, the DOC, and the Hill are roughly the size, they're bigger than a normal adjusting table, but they're roughly the size of an adjusting table. They're a little bigger, not so much wider, but a little longer, right? So you got to adjust for that. But it's manageable in that regard. So you got to think about that in terms of your clinic. Okay, what footprint is going to work the best? So here's the $1 million question. Doctors say, well, Dr. Vince, what table would you recommend? Most doctors, I recommend the KDT because it's well priced at $11,000, small footprint, highly effective, and a great support team. Again, Jeff and then Travis Buffy over there, they're studs. They're super tuned into their clients. They're always a phone call away. They have regular trainings and seminars. So, I mean, no one else is doing that. So the first principle in my consulting is let's elevate our doctors to expert status so they can be that specialist in their community. And that is shared by KDT as well. They want doctors that are highly proficient, because here is the dirty secret, guys, is if I wanted to be a race car driver, right? And I went and bought a fancy Porsche or something, does that make me a race car driver? No, it makes me a guy that has a fancy race car. Does not make me a race car driver. Okay. I got to put in the time and the effort and the energy to learn how to be a race car driver. And so a lot of doctors buy a table and it feels really good because they invested in themselves and they invested in the equipment and they invested in their practice, which is all great, but it does not make them an expert in spinal decompression and chronic back pain, right? You got to continue to level up your clinical expertise, your proficiency with the table, and all of that to really become a true spinal decompression specialist. So if you're not willing to put in that extra work, don't buy a table, right? Because you will, what will happen, I'll tell you exactly what will happen, is you'll get patients on the table, and in the beginning, you'll be fired up and you'll get patients right on there and no big deal. But then you'll start getting patients on there that don't respond to care because you're not you're not doing the evaluation properly. You're not ruling them in or ruling them out properly. And so they don't get the results. And then it shakes your confidence. And then the next ROF, you remember that, oh, that patient didn't respond well. They wanted a refund. And then that patient in the ROF doesn't sign up. And then that just kind of snowballs and your confidence is shaken. The table gathers dust. Maybe you throw a patient on there once in a while, but you don't really make it work. And it never turns into a good extra cash revenue stream of 10 or 20 or 30 or $50,000 a month because you didn't do it right from the get-go. So do yourself a favor, use these 4 principles of how to buy a table correctly. But if you decide to do that, then take that next step to actually become a specialist in spinal decompression and chronic low back pain. And that's what I help with, of course. So if this is you, and if you're thinking about doing this, or maybe you have a table and you haven't been able to make it work because this scenario sounds similar, first step, go check out that masterclass at drvinceleone.com, and it's in the post here as well. Go watch that, please. I was in a 7-figure practice, doing treating a whole lot of patients, doing very, very well, and I took all that information and I boiled it down to 60 minutes to 4 keys of how you can add and grow a high-value cash service in your practice, what I call a high-ticket niche, predictably and profitably, right? So that you can get sick patients better and you can feel good about yourself, right? And that you can actually become that specialist as opposed to just kind of being that commodity of a doctor that just kind of treats common neck and back pain. So I hope this has been helpful for you. My name is Dr. Vince Leone. Our business is called Specialized Practice Consulting. And if you have a colleague, please share this with them because we need more doctors offering spinal decompression. If you think the decompression niche is saturated, no, it's not. All you have to do to know that for sure is look at all those patients going into surgery. Probably half of them don't need to go into surgery. At least half should at least try the non-surgical approach first before going into surgery and all the risks associated with that. I mean, what's $3 or $5 grand when your life could be ruined by the side effects of a poor surgery? You know what I'm saying? So the vast majority of patients that are considering surgery should try the non-surgical approach first, which is spinal decompression. Okay, that's why I'm passionate about this, right? I'm passionate because I want patients to get this care. I'm passionate because our doctors are underpaid, and this helps them get paid better. So I hope this has been helpful for you. I'm Dr. Vince Leone, and like I said, if you fall in this category and you want to grow one of these cash services in your practice, you want to add a high-ticket niche, you want to do this the right way. First thing,